Every February, American Heart Month reminds us that our heart health does not go off duty when we go to sleep. Every year, there are hundreds of thousands of people across the United States that sustain a cardiac arrest. And most of the time, it's lethal. Many of these cardiac arrests actually happen in the home, specifically during sleep, which is a time when we are most vulnerable and least likely to be able to get help. One of the luxuries of being a host of a podcast is that I've had the opportunity to speak with cardiologists who truly understand the relationship between heart health and sleep. This month, I wanted to highlight 2 episodes from the past 3 years, one featuring Dr. Lee Surkin and the other featuring Dr. Paul Nguyen. If you're not yet a subscriber of the Sleep is My Waking Passion podcast, you are definitely missing out. You can catch the episodes that I have already taped with these 2 guests in their totality on YouTube, Apple, Spotify, or wherever you get your favorite podcasts. What I discuss with these 2 gentlemen are that there are many sleep disorders, some being common, some being less common, that are strongly associated with increased cardiovascular risk. Obstructive sleep apnea, insomnia, chronic sleep deprivation, restless leg syndrome, and even central disorders of hypersomnolence such as narcolepsy. All of these disorders can negatively impact your sleep quality, they may muck up your sleep duration, and they make it hard to create consistency with our sleep schedule because of how they make us feel. And the consequence of that ends up being things like the development of hypertension, abnormal heart rhythms such as atrial fibrillation, ventricular tachycardia, ventricular fibrillation, cardiac arrest, congestive heart failure. This Heart Month, my goal is to help you recognize the warning signs, understand why nighttime breathing problems and poor sleep quality aren't just nuisances, but cardiovascular risk factors, and to empower you to advocate for yourself for both testing and treatment when something doesn't feel right. And if you're a provider listening to this, know that these episodes are a crash course in understanding the pathophysiology behind why there's such a strong relationship between our heart health and our sleep health. If you or someone that you love snores loudly, wakes up gasping and choking, never seems to be refreshed, is falling asleep all the time, wakes up with morning headaches, wakes up multiple times a night to pee, has leg movements that are just out of control and they feel like their legs have a life of their own at night. They can't fall asleep. They can't stay asleep. These are indications that there might be a sleep disorder, and I am imploring you to go seek out the expertise of a sleep provider. If you are a healthcare professional and you need help finding a sleep provider that you can partner with, feel free to DM me, reach out anytime, and I assure you I will find a way to make that work for you. Because ultimately, we are all in this together. It doesn't matter what my specialty is or what your specialty is, or if you're a patient and I'm a provider, or I'm a patient and you're the provider. This healthcare ecosystem is dependent upon all of us working together, all of us advocating either from the patient side or the provider side to get the healthcare that we need and that we deserve. Your nights are not separate from your heart health, and caring for your sleep is caring for your heart. Remember that.
There are 2 different things. A heart attack is when you come in with chest pain, or at times you have fatigue and shortness of breath, that without a good reason, that may be called an anginal equivalent chest pain, similar to chest pain. And people often feel like you have to have chest pain in order to diagnose a heart attack. If I take a female above 65 going into the hospital ER with chest pain and a full-fledged heart attack, and without chest pain, most people will not diagnose that as a heart condition. So they would say you're anxious, you're stressed, you're fatigued. And only 50% of these patients with the heart attack had chest pain. The rest is fatigue and shortness of breath. So we have to define that as well. Cardiac arrest is what happens if you don't deal with your coronary disease or heart disease. Then it becomes an electrical manifestation that causes a cardiac arrest, and that's why patients need to be shocked out of a rhythm that is deadly called ventricular tachycardia. Everywhere you go, you see that AED, automated external defibrillator, so, literally on the wall, sitting right there or standing right there, waiting for somebody to have a cardiac arrest. But very few of us actually understand, that connection. So there are 2 different things. Cardiac arrest is majority of the times an electrical condition that may stem from a heart condition. And most people blow it off because they have fatigue and shortness of breath and not necessarily chest pain. There's about 550 to 600,000 cardiac arrests per year, and 82% of all adults, females, males, and children, 82% occur while asleep at home. That's why the connection of sleep apnea has to be prioritized from the get-go before anything else. So when you do go to bed and you sleep, that's when we're most vulnerable because nobody's around, no critical care doctor, no electrophysiologist, cardiologist. You have a spouse or may not have a spouse, and that spouse sleeps too. So all of those mechanisms that can cause high blood pressure, hypertension, atrial fibrillation, all of that comes into play at a very critical time when you're suffocating. And literally, just keep it simple, you're suffocating. So when you suffocate, it's like drowning. When you wake up, you're supposed to feel refreshed, rejuvenated, and you're ready to tackle a new day. Unfortunately, day in, day out, it gets you to the point where depression sets in, anxiety sets in, hypertension, and then you get what we call heart failure.
So obstructive sleep apnea is the poster child in this whole discussion about sleep in the heart. However, we must not lose sight of the contribution, the negative contribution that things like insomnia has, restless leg syndrome, other less common sleep disorders like narcolepsy have implications affecting the heart. You mentioned Dr. Grander. Mike Grander is an expert in behavioral sleep medicine. And in fact, he gave a riveting webinar on my academy about insomnia and the heart not too long ago, just a few months ago, on the American Academy of Cardiovascular Sleep Medicine. So what we know is, as I said before, that anything that disrupts the quality of sleep on a consistent basis can affect the heart. And there is an inflammatory process that occurs. Inflammation is associated with obstructive sleep apnea and other sleep disorders. Inflammation is bad for the heart. It leads to the development of heart disease, and it can increase the likelihood of arrhythmias and eventually even potentially the development of heart failure. So obstructive sleep apnea as the poster child has lots of bad stuff that happens. Your airway obstructs, the oxygen level starts to drop, the brain senses it, creates a surge of adrenaline, which is that fight or flight hormone, like you're about to be mugged. Your heart rate will go up, your blood pressure go up, you're ready to fight or run. So if you're about to be mugged, that's obviously a protective thing. But gosh, if it happens as a result of an airway obstruction repeatedly, now you've got all of this circulating adrenaline in your body that's affecting your heart. Combine that with drops in oxygen level, and your heart is really stressed out during obstructive sleep apnea. Insomnia, the disruption in sleep, the difficulty falling asleep, difficulty staying asleep, has similar negative effects to the heart, but not quite as robust as obstructive sleep apnea.
When I think about sleep and heart health, I look to, poor sleep that I generally will describe as being either, an issue with the quality of sleep or an issue with the amount of sleep that you get. So in general, that's the kind of broad overview definition. Anything you want to add to that?
You're exactly right, Alison. It's quality and quantity when it comes to sleep and the heart and sleep and really any other of the associated disorders. But specifically regarding the heart, it's critically important that, first of all, people get enough sleep. And there have been, I'm not going to go into the scientific trials, but other than to say that you can sleep too much, you can sleep too little. Studies have repeatedly shown that if you sleep longer than 9 hours or less than 6 hours consistently, then it will start affecting your heart and actually lead to bad cardiac outcomes like the development of cardiovascular disorders. So getting enough sleep in the right amount, and we usually quote 7 to 8 hours or 7.5 hours of sleep seems to be the sweet spot for that. And studies have shown that if you have let's say high blood pressure, diabetes, other medical problems, any severity of untreated sleep apnea can lead to an increased long-term risk of cardiovascular problems. If an individual is otherwise completely healthy, no high blood pressure, no diabetes, no, lung problems, whatever, if they have moderate or severe sleep apnea left untreated long enough, there's a significant increased risk of developing cardiovascular problems.
I have had some folks where you almost feel a little crazy for putting them on a machine. Like they're so mild. You're like, but if they're feeling like they're really unrefreshed or super tired during the day, even if it's quote mild or not that many events, I've had instances where I've actually put people on therapy and I'm almost blown away with how well they're doing. Like they literally are like, oh my God, this is so life-changing for me. If you are sleeping less than 6 hours, just to give you an idea of the sense of duration of sleep, what he was talking about was that you're literally like 55% more likely to be obese, which we know is not good for your heart. 21% more likely to develop high blood pressure, hypertension, and 33% more likely to develop diabetes. This was like, it kind of blew my mind because when we talk about all of those things, those are all sort of things that we see associated with issues related to your heart. And we talk about sleep apnea and how it could potentially increase systemic inflammation, and that systemic inflammation may also be related to the heart. There is actually a reciprocal situation happening here, meaning what happens too is when you have this untreated sleep apnea and you get to the point where your heart muscle is actually quite weak. The flip side is because it's not optimal, it actually can cause more issues with how you breathe at night. You get into these funky breathing pattern where you breathe real fast and you kind of stop breathing, you breathe real fast and you stop breathing. And it's very classic for heart failure.
So we have a lot of toys to deal with to take care of patients on the left side. But if we miss sleep apnea, you're just literally giving patients medicine while they're drowning. So you want to take care of the drowning first, then treat the heart failure. I think the predominance in terms of heart failure is right-sided. And we don't have a lot of answers for that. So that's why I'm so aggressive at lowering blood pressure and taking care of sleep apnea. That's the answer for the right side, not just medicine. Well, all of the right side therapy is also overlapping the left. So if you think about it, if somebody, and I hate to say this, it sounds scary. If you have a plastic bag over your face at night called sleep apnea and duct tape around it, your neck around everything to keep it tight, and you can't breathe, does it matter if you're going to treat for heart failure on the left side? It really doesn't matter. And when you treat people like that and you don't have the plastic bag off, meaning take care of your sleep apnea, your oral appliance, your CPAP, whatever works for you. If you don't do that, then you'll get depressed, anxious, and then people say, hey, you're not compliant with your medicines. It's because you feel terrible. So I think the treatment and the diagnosis of heart failure requires a continuum of making sure that we're not missing anything else that can attribute to worsening heart failure. And at the same time, when we treat the heart failure, we want to make sure that that you got therapy for sleep apnea from the dental side, from the pulmonary critical care side, from the cardiology side. And as the patient, I want you to be your own advocate and make sure everybody talks to each other and to come up with a really simple solution for you.
When you dig deeper into the studies, you find that the average amount of time that the subjects used CPAP was actually like 3 to 3.5 hours. So when you look at what happens with obstructive sleep apnea over the duration of the night when you're asleep, more of the events tend to occur in the second half of your night than in the first half of your night. Why? Because you get deeper sleep. You get more what we call REM sleep, or rapid eye movement sleep, which is where the body is at its greatest degree of relaxation, which increases the likelihood of more frequent airway obstructions. So now think about it. Take a step back. If an individual is using CPAP for 3.5 hours per night, they're going to put it on at bedtime, right? And take it off 3.5 hours later. Well, that's only maybe the first half of the night. And you're missing the majority of events that happen in the second half of the night. So granted, the studies have not shown beneficial outcome data in treating heart disease with CPAP. However, when researchers looked at the subjects that actually used CPAP longer than 4 hours per night, they started to show benefit. There's data showing that, for example, patients with atrial fibrillation, which is an irregular heart rhythm, if they have sleep apnea that's untreated and they go to their cardiologist to try to convert their rhythm to normal, there's a much greater likelihood of recurrence of atrial fibrillation if their obstructive sleep apnea is untreated. If it's treated, then patients do just as well as what we call control patients, patients who don't have sleep apnea. So there's lots of benefits in treating obstructive sleep apnea for the heart. There's data that's ongoing, that there's data that we need to be done to help us refine our practice guidelines so that we can give you, our patients, clear guidance on what to do.
Nobody knows that they actually have sleep apnea. So when you have certain condition, just go get tested. When you're sleeping, you're vulnerable and you're oblivious. So you don't have to feel that you have sleep apnea. I didn't know I have sleep apnea. I'm 135 pounds, right? So I'm the atypical person. So when in doubt, mindset, depression, ADD, heart condition, palpitation, go get a sleep study. Bottom line. And if the first one is negative because you didn't sleep, that doesn't mean you don't have sleep apnea. It's because you didn't sleep to have apnea.
Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleep coaching program, suspect you have sleep apnea, or simply seeking a second opinion, she's available for consultation in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 10-minute review of services today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted sleep expert.
Please be advised that the Sleep is My Waking Passion podcast is for entertainment and educational purposes only. It does not constitute medical advice. Always consult your healthcare provider for personalized guidance. For my full disclaimer, please visit AskTheSleepMD.com. And while you're there, don't forget to sign up for my free newsletter. Sweet dreams and happy listening.